you want to pull it up to block off the nasopharynx from the oropharynx to make sure the food goes downward. And there are two muscles here that do basically what their names say. So there's this big one here coming from the soft palate, so going into the base of the torus tuberous, known as the levator veli palatini. So it's going to raise the soft palate. And then there's this other one over to the side and slightly anteriorly called the tensor veli palatini. So it's going to tighten the structure. So basically you have a structure like this, where your soft palate's dangling down with a uvula in the middle. So the one on the outside is going to sort of raise it up, the levator. But the problem is it's still sort of dangly here because the levator's pulling from the side, and the tensor basically makes it a flat structure so that it closes off the oropharynx. It's easier to see in your dissection than my hand, but that's what happens. Okay, and then this other muscle, the salpingopharyngeus, going from the tube down to the throat, back of the throat, the pharynx. And then there's the palatopharyngeus, which is coming down, remember, forming part of the tonsillar bed. And then the stylopharyngeus, which you saw in the back of the neck. So there's a whole bunch of muscles coming from the sides, basically, of the pharynx, and going into, the sort of blend into these pharyngeoconstrictors in different ways. There's the uvula. The other side of the tonsillar arch, the palatoglossus and the palatopharyngeus, and there's the bed of the tonsil line. Okay, so let's go back to this. Levator veli palatini, basically it does what it says. It originates right here on the edge of the eustachian tube and the petrous part of the temporal bone. Temporal bone's right there. Inserts into the palatal aponeurosis, that connective tissue at the edge between the muscle of the soft palate and the hard palate. And when it contracts, it pulls the palate up on either side. There's one on the right, one on the left. Slightly anterior to that, and you have to sort of dig to find this one, is the little tensor veli palatini, which lies in an area known as the scaphoid fossa. And basically, it originates from what's known as the sphenoid spine and this cartilaginous tube that makes up the eustachian tube. So the eustachian tube is basically a piece of cartilage that's sort of folded like this. So normally, a piece of cartilage are folded, no air can go from the back of the throat into the ear, but levator veli palatini inserts onto the side of this, and when it contracts, it opens the eustachian tube so that air can travel between the middle ear and the nasopharynx. And that's why when the airplane's taking off or the airplane's landing, they give you a hard candy, hoping you will suck on it, and every time you swallow, it will open up that tube so that the air between your ear and your nasal cavity is equilibrated. But this tensor veli palatini has a twist to it because it comes down from the side and hooks under that hamulus at the back of the pterygoid plate. So that whereas levator palatini is pulling the palate up, this looks like it should be pulling it up, but in fact it wraps around this little bony process, so it ends up pulling directly to the side. And that's how it tightens the palate. So, okay. So there, this shows it. Here's that hamulus there. So the tensor veli palatini comes down under the soft palate, wraps around this little bony lever here, and heads straight medially. So that when it pulls the two sides of the soft palate against each other so it gets tight and forms a firm structure to separate the oral cavity from the nasal cavity. So just to repeat that, these are the muscles that seal off the soft palate when you're swallowing. Keeps food or water or milk, whatever you have, from coming back up into the nasopharynx. The levator elevates the soft palate and brings it into contact with the posterior wall of the pharynx so that nothing can go from the oropharynx up into the nasopharynx. Tensor tightens the soft palate. It pulls sideways so that the soft palate is a firm structure, and it also opens the auditory tube so that when you swallow or yawn, again, you're equilibrating the air pressure between those two areas. Okay, so here's, again, a little, what involves in swallowing. The food enters your mouth, your tongue pushes it backwards, and the superior constrictor pulls the pharynx forward, and you want the food to go inferiorly down here into the esophagus. So the levator veli palatini pulls the soft palate up instead of dangling in the back. It compresses it against the top of the pharynx here, the back of the pharynx here, and tensor veli palatini makes sure it's a firm structure. It isn't sort of dangling down in the middle, so the food can't go superiorly. The tongue and the constrictors basically force it down into your esophagus. Okay. Also, again, in the back of the pharynx, as I said, there's this salpingopharyngeal fold. If you scrape away the mucosal tissue over above it, you see a little muscle, the salpingopharyngeus muscle. As the name implies, it originates on the tube here, the cartilage of the eustachian tube, and inserts, blends in with the constrictors, with the muscles in the back of the pharynx. So it just goes into the back of the pharynx. Palatopharyngeus, coming from the soft palate, also going into the back of the pharyngeal region. And you can sort of dig these out, get rid of the mucosal tissue overlining them, and find the individual muscles underneath. And then way down here is the stylopharyngeus, which you saw on the back side of the pharynx, right? And it comes down and blends in on the inside of the pharynx back here. And the uvula itself actually has a little bitty muscle in it, which originates from the posterior nasal spine and the aponeurosis up between the hard and soft palate. Okay, so those are the muscles. All you see when you open up the side of the pharynx, which you split in half, and you see all these folds. Dissect that tissue away, and you'll find the little muscles underneath. So if you know where they come from and where they go through, they have the same names as the folds, but they're actually muscle tissue. So when they contract, they can either move different parts of the soft palate or the tongue or the pharynx relative to one another. Okay, arteries and nerves down here in the back of the throat. There's a huge blood supply coming into this area, which is the tonsillar bed. Okay, so here's your palatoglossus and palatopharyngeus. So this is the area where the palatal tonsil would lie, and realize that there's branches from the lesser palatine going back, and a whole bunch of other, lots and lots of arteries send little branches, because the tonsils are a lymphoid structure. They need a big blood supply. Obviously, this is the main reason why removing tonsils carries some risk, because there's a lot of blood there, and if you happen to cut some of those and don't tie them off or don't cauterize them or whatever they do, tonsillectomies can cause a lot of bleeding in the back of the throat. Way down here, you'll recall back here on that stylopharyngeus, you found the glossopharyngeal nerve, and then it sort of disappeared into the back of the pharynx. And coming down here, it reappears right at the base of the tongue, comes right through here at the bottom of the tonsillar bed, and slides into the base of the tongue, where it supplies taste and sensation to the posterior third of the tongue, and also some little branches up to the back of the pharynx. Also, just below this tonsillar bed, when you dissect into that area, you see the stylohyoid ligament coming down just under the glossopharyngeal. Okay, so if you dig down, open up that tonsillar bed, you should find basically the glossopharyngeal and other structures in there. Okay, that is essentially today's dissection. Okay, the rest of the lecture is stuff you're going to be worrying about tomorrow. It'll be tomorrow's dissection. So I'm going to go over it today because tomorrow you're going to learn all about, or review all about parasympathetics. Salivary glands. Okay, we already know one big salivary gland, the parotid. That's a lot bigger than these. And you've also heard, obviously, about how these salivary glands in the tongue region, how they get their blood, how they get their innervation. We'll go over this. Okay. Here, well, help. Back. Okay. The big one, the one we've seen before, the parotid gland, filling that whole area of the cheek right in front of the ear. And then you saw this big parotid duct coming in through, going through the buccinator muscle up here, opening on the inside of the cheek, usually right opposite the upper second molar. And here, pretty vague, but that's the way things are. This is a picture taken inside of the mouth where you're seeing the opening of the parotid duct. So the parotid papilla it's called. And that's where the parotid duct empties saliva inside the oral cavity. Okay. There are a couple of other salivary glands that you've heard about. Okay. Here on the side under the tongue, so the tongue's been raised up. So on the side of the oral cavity, adjacent, on the side of the edge of the tongue, the side of the tongue, is the sublingual gland. And they extend almost the length of the tooth row here. And they open directly into the oral cavity. So you see all these little openings called plicae. Okay, there's apparently about a dozen of them opening into the underside of the cavity on the side beneath the tongue. And there they are. That shows there's the sublingual glands are down there, that stuff right there. And you can see they have a blood supply and they open directly into the side that hasn't been dissected. So these little openings here are how the sublingual gland allows saliva into the side of the oral cavity on the edge of the underside of the tongue. Okay, the other big salivary gland in there is one you saw when we dissected the neck way back when, and there was this big bulging gland sitting down here under the lower jaw, which we asked you to get rid of it so that you could find things like digastric and other structures under here. It's like right here, and it's a U-shaped thing. So it's sort of, part of it is below mylohyoid, part of it is above mylohyoid, more directly underneath the tongue. That's why it's called the submandibular as opposed to just sublingual. It's way down here at the bottom of the mandible. Unlike the sublingual glands, which sort of open directly into the oral cavity, the submandibular gland has a duct, this green thing, that crosses from the posterior area of the oral cavity anteriorly and opens up into a little sublingual, called a sublingual caruncle. So it has a duct with a single opening on each side, right where the frenulum of the tongue joins the floor of the mouth. And apparently some people are really good at squirting their submandibular glands and have accuracy contests. If you go to YouTube, you'll find that there's some incredibly skilled folks out there. We've never had a submandibular squirting contest in here. I hope we don't, but realize that there is a cult out there. Okay, here's yet another picture, just so you can see. There are about 3 pictures of this. Here's the bottom, here's the tongue, okay? Here's the midline, the frenulum of the tongue, and down here, okay, is the submandibular duct right in the front of the mouth. You see it's right behind the incisors, okay? And that's where the submandibular gland empties the saliva. Okay. Once again, same thing. Here's the opening of the submandibular gland, call it its caruncle, and lateral to it on either side are the individual plicae, a dozen little tiny holes where the sublingual glands are. So everything ends up sort of in the front and side of the tongue there. But realize one has a long duct that you'll see in your dissection, and one doesn't have any ducts to speak of that you'll ever find. Okay, once again, just to show you the orientation. So up here's how the upper lip is tethered to the gums, called the frenulum of the upper lip. Opening the parotid gland over here on the side of the cheek. Okay, here's the frenulum of the tongue, which sort of ties the tongue to the floor of the mouth. The sublingual plicae are on the side here, and the that's a mistypo. This should be the submandibular caruncle. The single opening of the submandibular gland is right near the midline on either side, and this is another frenulum of the lower lip. So these are just these little midline structures that tether the tongue to the floor of the mouth and the lips to the gums. Whoa, lots of arms. Yes?
Isn't that the sublingual caruncle is the opening for the submandibular duct?
No, that's not sublingual. That should be stay submandibular.
On the previous slide.
Oh, really? Well, that shouldn't be the case. Yeah, well, okay, I guess the caruncle is called sublingual because of its position. Yeah, it is the opening of the submandibular duct, but it is under the tongue. Sorry. Okay, innervation. You've been through this before, but that's okay. You remember the parotid gland, okay, gets its innervation from the glossopharyngeal in sort of a roundabout way. Okay? That cranial nerve 7 innervates both the submandibular and sublingual glands via the chorda tympani, which goes into the lingual nerve and then travels underneath the tongue to innervate both these guys. This parasympathetic innervation induces the